KANCO, a premium membership organization of non-governmental organizations, having vast experience in improving the health and well-being of community through capacity building and innovative leadership, was awarded the Health System Strengthening Project grant in 2017. A project designed under tripartite agreement between GAVI, Kenya AIDS NGO Consortium KANCO, and the Government of Kenya. A project that was launched by the President. On the first grant to the CSOs, the intention was to complement the government's effort through the policy advocacy for immunization financing and legislation and community mobilization. This way, immunization status has improved respectively in counties. The Health System Strengthening Program taking place in 17 counties, and that is Nairobi, Nandi, Bomet, Tana River, Garissa, Baringo, Homa Bay, Kakamega, Mandera, Isiolo, Meru, Kitui, Wajir, Bungoma, Trans Nzoia, Nakuru and Laikipia. With the GAVI, the Health System Strengthening Program objectives focusing on acceleration of strong political engagement while improving governance and financial sustainability for immunization outcomes in line with devolution, to achieve equitable access to and utilization of routine immunization services in 17 identified counties.
One of the key approach for this project was policymakers' engagement, which is aimed at promoting ownership, promoting sustainability, at the same time supporting the country as we transition.
Being the first grant to go through CSO directly in Kenya, the county's achievements through the support of the CSO and the government in respective counties has been of rising scale. Immunization percentage in 17 counties rising from 40% since 2017 to 90% until 2020.
We had some very good outcome for the last 3 years, or what you may call impact. At the national level, we were able to engage members of parliament, and because of the various engagement, they were able to double the allocation to the National Vaccines and Immunization Program from the initial allocation, which has been yearly around 750 million Kenya shillings to around 1.4 billion Kenya shillings.
The stand is that to immunize one child fully, according to statistics done in 2017, you need 3,000 shillings per child, and that is up to 1 year. You haven't even gone up to 5 years, and that is an accumulation of the human resources for health, the place you're using, the utilities, all that. Just one child up to 1 year costs 3,000 shillings. Now, looking at the number and the fertility rates in Kenya, you're looking into almost over 1.5 million children every year that need that kind of immunization.
Health System Strengthening Manager at KANCO supporting GAVI grant, Elizabeth Omaitha, paints a picture on how immunization situation was before the grant was implemented.
And since 2018, we had been able to bring back to care more than 32,000 children from the 17 counties.
After 1 year of implementation of the grant in 2018, the three parties decided to restructure the program by assigning community health volunteers number of households to cover.
That is when we decided, why don't we go the community strategy way? Have the CHV, yes, we meet them monthly, but when they're coming with data of children who have been defaulter traced, because those children are needed back into care so that they can go back into the system.
Through the project, we were able to initiate what we were calling the LEAP. The LEAP was an online platform whereby we were able to educate and engage the CHVs to continue with their work of defaulter tracking, especially in the context of COVID, where we could not have physical meeting together with them.
Through the influence of GAVI project, policymakers also developed Community Health Services Bill. This bill talks about community volunteers who depend on donors. The bill also looks at the recruitment process, select and training of community volunteers. The allowances of these backbones of the community health services have been a motivation. Hence the reduction in number of children defaulting from immunization between 2018 to 2020.
This bill talks about community health volunteers, but they have opinions in the communities and they are listened to. Wanasema wanawaita daktari wa nyumbani ama wa kijiji, but they are community health volunteers. However, they depend on donors. Does KANCO have a kitty for the CHVs? Then they will do the work. And yet, is there the backbone of the community health services? You cannot have a community strategy without the CHVs. So why are they not sustaining them? Why are they not giving them allowances? So that is what the bill was talking about.
One of the trained community health volunteers is Aisha Misi, based in Eastleigh, Nairobi. She does household visit twice a week, moving door to door to check on the health of the families. Missy, like her other colleagues, does a lot of health checkups. That is disease surveillance, in which they normally refer the sick to the nearest health facility.
I appreciate so much KANCO, of which they have been very much supportive for motivation. The CHVs have been motivated to reach every child that has missed immunization. And for the families, at least the babies have been immunized fully. And you find that most of the families that have been having so many problems with diseases, at least it has reduced.
Poverty gap is also another experience in Nakuru County. The city part gives them almost 80%, but when you go to the informal settlements, the immunization coverage is way below 40%.
Poverty becomes an issue, and we all know we don't have minimum resources to move. Chances of that, and that again, when you're talking about poverty, there is the real poverty numbers. There is this mother who is sickly. There is this mother who is always having a child after a child. They don't have time or space to grow. There is this mother who don't have adequate food. All that reduces issues of access, and that's why when you're talking about immunization, there must be equity.
Data on immunization coverage for antigen in Nakuru County shows that Bacillus calmette-guerin had the highest increase of 95% in 2020 from the initial 82% in 2018.
Gains that we've been able to achieve in the last years, like having to keep the number of unvaccinated children at that low, because we plan to have the strategies that we are doing in these 2 sub-counties that KANCO is supporting to practice the same in the other 9 sub-counties, and therefore, of course, the county government has promised to support us on that.
In Garissa County, 5 new immunization facilities have been established in the entire county to bridge the access gaps. The program has seen percentage increase in the yearly county budget allocation for immunization as proportion of the previous year's allocation. Mandera County has a history of measles breakout in 2011 and 2018. After KANCO sensitized 70 CHV and engaged them to carry out defaulter tracing, 7,480 children were traced, immunized and linked back to care.
We have increased our immunization budget, our health budget from 21% to 30%.
As a result, the Penta 1 coverage, which was at 55% in 2018, increased to 88% in 2020.
And just to give you a case in point, Mandera for 3 months, that's October, November, December, were able to defaulter trace 1,231 children. That is just one county out of the 17. So I think it has also given them hope that the children now don't have to die, because the CHVs, through the same system for TB and HIV, are able to bring back the children to care. And I think that's an invention or an innovation that as KANCO we are proud of. Because in the whole of Kenya, nobody actually was doing defaulter tracing for immunization. It was an assumption that mothers would still bring their children, but yet the mortality and the infant mortality rate and neonatal mortality rate was pretty high. So that means the children we were missing were dying. And we all ask, why should a mother carry a pregnancy to 9 months only to lose the baby to vaccine preventable diseases? It wasn't working very well.
Baringo County, which is situated in the Rift Valley region, enacted Community Health Service Bill (CHS) and Facility Improvement Fund Bill. Operationalization of the bills had to reach areas, and the county commitment for 10 million for immunization activities for the year 2021.
For Baringo County, I would say KANCO was able to at least support us to have meetings with our county assembly members on immunization, and the outcome of these particular engagements with our MCAs is that the MCAs are supporting immunization, and what they promised, like this financial year, is that they will allocate 10 million towards immunization program.
The prioritization of budget-making process and immunization finances has eased the dependency of syndrome. This is an assurance that even when the donor withdraws, Baringo County will have a community of immunization services in making sure that every child in the region gets immunized because it is in their right. The neighboring Nandi County's impacts of the GAVI grants has increased the number of children reached through the outreaches, improved vaccine management skills, increased number of immunization facilities. The county also had reduced fridge breakdowns as a result of continuous preventive maintenance and improved reporting rate. A look at the percentage improvement in Bomet County shows a gradual reduction of the number of children defaulting. KANCO, through GAVI grant, trained and supported 43 community health volunteers to do defaulter tracing in different parts of the county, which made it easier for the county to immunize. The program also sensitized 40 grassroots vaccine champions. 2 of them are actively involved in advocacy activities for immunization. Meru County had an increase in the number of sub-counties supported by KANCO.
So in 2018, the reports by CHVs of tracing the defaulters was at 25.4% in 2018 when KANCO came in. That number rose to slightly 29.9% by end of 2019. And we can proudly say by end of 2020, that reporting rose to 92.8%. That is a great achievement.
Isiolo County engaged 780 community health volunteers in immunization demand generation. The program also equipped 7 policymakers with skills to address local immunization sector constraints. Through the GAVI Ground CHVS support, 16 health facilities also supported the number of increase from the initial 3 sub-counties in 2018 to 9 in 2020.
Really, KANCO played a role. In most of the meetings I attended with them, they have engaged CSOs, religious leaders, shock opinion leaders, civil society organizations. They had also meetings with the high level advocacy, and also they were able to engage local radios, the local radios we have, the FMs, and also journalists.
The other issue that we've had to deal with in the GAVI grant, and this has worked very well, is making the MOH and the civil society come together. And these local CSOs were engaged. In every county, there were more than 30 CSOs that were engaged. And what these CSOs have done is that when even the Ministry of Health is not able to do support supervision, if a facility is closed out, they are able to go lobby and that facility is opened up again. So it has been successful to involve these CSOs. And for me, that I think is a huge progress. Because whether KANCO is there or not, work and services will go on.
Bungoma County, whose population is projected to be approximately 1,787,575, had the triple effect of KANCO project, influencing uptake of new malaria vaccine. through trained community health volunteers. Immunization against malaria has been high. This vaccine had been introduced during the KANCO-HSS implementation, also something to be proud of. The neighboring Kakamega County recorded an increase in immunization. MR1, MR2 and F1CA1 uptake increased gradually between 2017 and 2020.
And I cannot forget to mention what Christine has mentioned about the cold chain equipment that was already that came to the facilities. And you know, we have facilities in each ward and each MCA represents a ward. So they were very excited to hear the names of the facilities listed from their wards as having received the cold chain equipment.
At the same time, dropout of the same reduced between the same period of time. Trans Nzoia County coverage shows an increase between October 2019 and June 2020. BCG increased from 63.5% to 90.3%. Penta 1 increased from 69.2% to 92.4%, while Penta 3 increased from 63.9% to 90.5%. FIC had the highest increase in coverage, which was from 58.4% to 95.5%.
For the time we worked together with KANCO in our country, the EPI services were brought into the highlights. Previously, there used to be complaints about EPI. There were complaints that our immunization coverages were low, our presence was not being felt. But after active engagements with KANCO, we were able to work together with the media personalities in our county, and we were able to be given free airtime by the media stations, at least 3 of them. So every week, 3 days in a week, we are able to go to the stations and mobilize our communities to access immunization services. In fact, the first day that we talked over the radio, so many people came out, and we even had people who are bringing their children for immunizations for the first time at 3 months.
In Homa Bay County, 150 community health volunteers were engaged for immunization demand generation. 15 policymakers were also sensitized and equipped for skills to address local immunization sector constraints. 15 MCA engaged for improved immunization.
So when now we engaged them and there was the support from KANCO, at least we saw quite a number of the CHVs pulling up their socks and trying to do defaulter tracking on a monthly basis. And this gave us a number of 25,000 defaulters that were traced over a period of 2 years.
50 religious leaders engaged for improved immunization services. As a result of the capacity building and coordination, FIC coverage increased in the respective 8 sub-counties within Homa Bay County. Rangwe sub-county had the highest coverage increase, which was 82.3% in 2020 from 76.8% in 2018.
And we had the opportunity to be able to go to the island that is the largest in the county, Mfangano Island, where we have like 10 facilities. So we hardly have support to go to that island, but this time around we were supported by KANCO to be able to go there and actually support those health workers who are many a times sidelined. As you know, traveling to the island becomes a bit tricky.
As at 2017, Kitui County had registered 21,000 children who were not vaccinated. This gap has been bridged after KANCO created demand of immunization services in the region. For example, Penta 1 coverage increased from 74% in 2017 to 81% in 2020. Penta 3 increased from 67% in 2017 to 78% in 2020. MR1 increased from 69% in 2017 to 80% in 2020. And finally, FIC coverage increased from 66% in 2017 to 79% in 2020. Tana River County, which borders Kitui County to the west. Coverages per antigen decreased between 2018 and 2020 during the KANCO partnership. DPT/HEP plus HIB3 reduced from 79.9% in 2018 to 74.6% in 2020.
What I'm proud of most following the KANCO support is the uptake of HPV in our county. Initially, there was a lot of resistance, but after KANCO came in our county, we had a lot of engagement with the community, and that is the time when the uptake of HPV took up.
Bungoma County, whose population is projected to be approximately 1,787,575, had the triple effect of KANCO project, influencing uptake of new malaria vaccine. Through trained community health volunteers, immunization against malaria has been high. This vaccine had been introduced during the KANCO HSS implementation, also something to be proud of. As GAVI grant-supported projects mark 3 years, Executive Director of KANCO, Alan Ragi, expresses his satisfaction by the fact that the project has created demand for vaccination services.
I can say I'm proud to have been engaged in this program. One, because if you look across the country, none of them have not progressed positively. If you look across the country, they have engaged people through their community health frontiers. If you look at the county, they have engaged the professionals themselves, the nurses and all that. If you look across the county, they have engaged members of county assemblies, and they have engaged their governors. That tells you that's one way of building sustainability, because everybody is following up.
Dr. Collins Tabo is the head of immunization program, Ministry of Health in Kenya, and acknowledges that the GAVI/HSS project has placed Kenya on a futuristic pedestal which we must build on. That Kenya has seen significant improvement in equity and political goodwill for immunization, with the budget allocation having doubled.
I'm indebted to KANCO in this meeting is that for the first time ever, we are having a deliberate link between communities and service delivery. For the first time ever, we're having a deliberate link between immunization and our leadership in terms of getting them to take charge. For the first time ever, we're having serious legislation going on in the counties and people discussing very strongly immunization as it is, as a service, not just for our people, as a service to humanity, and just not wishing to leave any child behind. Basically, the desire to protect our generations, the future generations to come, is been heightened through the engagement of KANCO.
He further says that everyone must be committed to support children for the sake of future visions.
Counties have been able to develop an immunization bill. Some have also been able to develop a community health services bill, which is important to support resource allocation, at the same time to promote ownership of immunization programs by the counties.
All this had taken place during the joint learning, experience sharing and feedback meeting held in Machakos County in the last 1 week of February 2021.
And that's why when you're talking about immunization, there must be equity. There must be equal access for every single child in this country.
Reaching the communities that are otherwise mixed with vaccination. Through the integration of the missed opportunities at community level, the missed opportunities at the health facility level, the engagement and linkages, we've been able to do what? To improve immunization coverage. Then
the progress we have made, the gains we have made, so many children so far has been traced back, that is sustained. It means that we need to look for a way to make sure that the CHVs are still doing, that is the community health volunteers, continue doing the work even in this transition period. And even after June, we need to have a very clear mechanism of how we'll continue engaging them to do some default tracing work. The other thing I also want to look at as a challenge is how also we are going to sustain engaging members of parliament or the policy makers, members of parliament at the national level, members of the county assembly at the county level, to make sure that because next year we have the election, we're likely to have new elected leaders. How do we also make sure they are well educated? No, not well educated, but they are sensitized, they have enough information on the need to support immunization.
Have a look at the general findings of the HSS project in the county that revealed 12,126 community health workers that have been supporting the lifting of defaulters traced to 104,262 between 2018 and December 2020. 748 CSOs have been involved in the entire program, with 1,276 religious leaders at the forefront. Also, 326 MCAs and 424 health journalists have been trained and engaged to amplify the importance and the need for every child to be fully immunized.